Three, two, one.
Hello, everybody. Welcome back to 2024 Fertility Factor Fiction. I am your host, Dr. Rahi Victory. I am a board certified reproductive endocrinologist and infertility specialist in both Canada and the US. Double board certified. I am here with my dear friend Tarek Ibrahim from Ibrahim Strategies Group, our guy who does all things social media. Hope you guys all had a wonderful, wonderful holiday season. If you celebrate Christmas and/or New Year's, hopefully it was joyous and full of love and family and friends. And if you don't, hopefully it was an opportunity to get some downtime and relax. I made it up to my cottage where there was absolutely no snow, but we did manage to introduce our kitten to the cottage, which was an interesting experience. And he spent most of his time chasing from window to window watching squirrels go by. So it was quite fun. We relaxed, we ate a lot, and had a good time. So watched a lot of good movies. Definitely, if you guys have any good movie suggestions, I am all ears and open for that. So it's been months since we've had a good study, but I found one that was really quite interesting because of its simplicity. I'm not sure it's as rock solid as we would like it to be, but it is very, very interesting and some neat data to share with you that is kind of critical to look at because it's showing something that I've been talking about for quite some time, and it has a bearing on a lot of the different things that we've either said or are currently doing in the fertility world. So I know it was quite controversial when I told everybody that they should not be transferring embryos near COVID because of all the inflammation. And there were studies coming out saying it didn't matter. And I said, there's no way that that's possible. It simply doesn't make sense. But the reality is that anytime you inflame your immune system, you are going to end up in a situation where you have a much higher than normal level of inflammatory mediators, natural killer cells, macrophages, lymphocytes, and so on, all of which are designed to protect you from a foreign invader or from an infection. When your body is experiencing a pregnancy, because half of the genetic material is not coming from the host, the woman, the reality is it can, in some instances, assess the other part of the genetics, the male part, as being foreign or potentially harmful. And so the whole idea is if the immune system is overactive, it can attack. And if it's underactive, it may kind of let anything go through. And so you want that nice normal balance where it's allowing the embryos to implant and protecting them without attacking them or making it too easy for non-viable embryos to stick, which would then lead to a miscarriage or failure. So there is this new measure called the Systemic Immune Inflammation Index. And essentially, what they did was they took your complete blood count, your CBC as we call it, and they took out the platelets and they looked at your lymphocytes and neutrophils and they said, let's just mishmash this all together in this, random calculation, and this kind of tells you what the overall inflammatory status of the body is. And then let's apply this to various health conditions and see if they are impacted or if this value is predictive of adverse outcomes. So they've used it for cancer, they've used it, I think, now for diabetes, they've used it for a variety of different conditions, including COVID-19, to see if the degree of inflammation in your body is predictive of the outcomes. And in fact, in those areas where they have looked at it, they did suggest that there is a significant impact. So then these guys decided to try this for fertility. If it works in other things, people always say, why not try it for fertility? So they wanted to look at, is this S triple I or S double I measure, which is super, super simple to do and very cheap, predictive of your IVF outcomes. So I want to set the stage for you because this is important. Number one, this is a Chinese study. So it applies only to patients that were in China. It does not apply to a global population. So whether or not their inflammation is different from other people's inflammation, I don't know. It's a good question. Number two, it was done pre-COVID. So they ran this study from 2018 to 2020. Hard to know why it took so long to get it published. I'm a little bit skeptical of that, but it's possible that they didn't even look at this again because of everything that was going on with COVID in China at the time. I don't know. There's no answer for why it took them 4 years to get this published. Number three, they used fresh embryo transfers in this study. So this is not using frozen embryo transfers, which, as you all know, is A, something I advocate for, and B, a big part of what we are doing more and more in the fertility world these days. These guys used fresh embryo transfers. And their population was very unique. Age was greater than 20, less than 40. You're not dealing with older patients or very young patients. They generally had very reasonable BMIs. These are not patients that are obese, as is typical with the Chinese population. The patients tend to be a bit thinner. They have far less problems with obesity than we do in North America. And they were very specific about their exclusion criteria. They did not take people with endo. They did not take people who had chronic inflammatory conditions, no one who had any active diseases. They only took people doing their first cycle of IVF. So it was quite clean in terms of the data set that they were using. On some aspects or facets, that's a good thing because you know exactly the population you're looking at. And on the other hand, you got to make sure that it doesn't necessarily apply to everybody because not necessarily everybody fits those exact criteria. So I don't know if you can share. Can you share the study right now? Tarek's going to share this with you. So it's called the Association of the Systemic Immune Inflammation Index with in vitro fertilization treatment outcomes in women undergoing GnRH antagonist protocol, and it's a cohort study. So it's not exactly a cohort study. They actually looked at this retrospectively, so it's actually just a retrospective cohort study. And what they did was they looked at all the patients that had gone through and had this lab data available, and then analyzed it and compared it to the outcomes. So this is as yet unpublished. It is coming out in Reproductive Biomedicine Online, one of my favorites, and I really love this journal. So their ovarian stimulation protocol, pretty simple. They used anywhere from 150 to 225 units of Gonal-F. They did not use any Menopur or anything like that. So it's a real, again, clean study in terms of what they did. They started Cetrotide anywhere from a half dose to a full dose. Never heard of anyone using a half dose of Cetrotide, so that was interesting. And they did that when the largest follicle was about 12 to 14 millimeters, same thing that we do. When they had 18 millimeter follicles, two of them or more, they triggered with 10,000 units of HCG. And as you'll see very shortly when I show you the data, the number of eggs that they got in their study way lower than some of the numbers we see in North America. So that was quite interesting as well. How do they calculate this? You can see it right there. I'll blow this up for you. So it is your platelet count multiplied by, in brackets, your neutrophil count divided by your lymphocyte count. So essentially this number, and I'm not sure how they came up with this, is a marker of how inflamed your body is. And so the higher the number, the more inflammation. Your platelet count is representative of systemic inflammation. Your neutrophil count is definitely a marker of systemic inflammation. Anytime you've got a bacterial infection, you'll see a huge rise in your neutrophil count. And so all of these are markers of increasing inflammation, and the lymphocyte count can knock that down a little bit because they can be the ones that are coming in to tame the immune response at times. So the whole idea was to get a marker of how inflamed the body is. They've come up with this number. This is from a like literally $2 or $3 test that anybody can get. In fact, we always jokingly say that if you walk into any Emerge anywhere in North America, there is no way you're walking in without getting a CBC done. So this is a very garden variety daily test for any hospital, any clinic working with patients all over the world. Okay, so their outcomes include pregnancy losses, biochemical pregnancies, implantation rates, and so on. Okay, so we're going to skip over to the tables because that's where all the information is. So I'll brighten this up because I'm having trouble seeing it myself. Okay, so when you look at their baseline characteristics, no real significant difference in the baseline characteristics. Would this be better if I turned it sideways? I knew Tarek was going to say that. So yeah, there you go. Okay, so very few differences. A little bit of a difference in age, as you can see in that first row, but these are not clinically meaningful differences. I mean, your lowest number was 31.6 and your highest number was 32.95. That is not high enough for us to worry about. And they broke this up into quartiles for the range of figures that they had for this systemic inflammation index. So they just took all the numbers and they said, okay, we're going to break it up into quartiles, 25 percentage points a piece. Quartile 1 has the lowest amount of inflammation. Quartile 4 had the highest amount of inflammation. So yes, the age was a little bit higher in quartile 4, but not clinically meaningful. There are no other significant differences until you get down to number of abortions, which are rated as 0 across the bottom, but there must have been some numbers in there because they somehow found that 0 was statistically significant. I'm not sure where they came up with that from. The body mass indexes were not significantly different. The AMH levels were not significantly different either. And when you look at some of the other things, their starting dose on gonadotropins was a little bit different, but again, not clinically meaningful. Your lowest number is 236, your highest number is 250. I have never even dosed people that sort of specifically. We'll use big numbers like 225, 250, 275. And typically with us, we're doing it in 50-point increments, although we do occasionally adjust a little bit. They had a little bit of a difference in the total dose, but again, not significantly meaningful. Your lowest number there, 2100, your highest number, 2225. And then they did see a difference in the HCG value after they did a trigger. And interestingly, they measured that 12 hours later. But again, it's not clinically meaningful. Your lowest number is 107, your highest number is 123. We wouldn't act any differently on those numbers at all. So I don't think they're clinically relevant. Okay, what did they find? Absolutely no difference in any of the outcomes in terms of number of eggs retrieved, number of embryos, 2PN, number of cleavage stage embryos, number of embryos transferred was all the same. You can see they frequently transferred 2 embryos instead of just 1. The number of available embryos is the same. Everything was the same right across the board. The number of blastocysts they got. So your inflammation index does not change the number of eggs that you're going to get. It doesn't change the number of embryos you're going to get. It didn't alter anything in these groups in terms of number of embryos that were transferred. And it doesn't change anything about the stage of the embryos at the time that they were transferred, whether they were day 3s or day 5s. So no differences there, which is important. A little bit more data just looking at the number of embryos they transferred, whether it was a single or a double transfer, again, not clinically significantly different. And the fertilization rates also didn't differ between any of the groups. So super important for you to see all of that stuff. But when you got to the actual outcomes, which are on table 3 here, you can start to see quite a significant difference. So if we look at, whoops, sorry, let me get some markers here. Okay, so if I take, I don't know if this will work. Yep, there we go. If I take all of this graph and I show you what's happening here, you can see that the live birth rate was very statistically significantly different. In particular, if you look at this quartile here, the 4th quartile, and I apologize to those of you on TikTok, you can't see this, so I'm going to describe it to you. In the group in the 4th quartile, 70, almost 6% did not have a live birth. Only 24% had a live birth. Whereas in the 1st quartile, 41% had a live birth. So that's quite a significant difference. You're looking at almost a like 60% increase in live birth when you go from that high inflammation index to the low inflammation index. Why is this important? Because if you're sick, if you have a lot of inflammation in your body for any variety of reasons, it could be obesity, it could be diabetes, it could be recent vaccination or infection, you're going to see very significant differences in how your body responds to this stuff. What about early pregnancy loss? Exact same thing, a highly statistically significant difference. Your early pregnancy loss, if you're in the lowest quartile, was 14.9%. In the highest quartile, over double, 32.7%. Huge increase in miscarriage if you have this inflammation index. Biochemical pregnancy, again, highly statistically significantly different. 52.3% were in the first quartile and 39.7% in the last quartile. So big increase in biochemical pregnancies if you have that low inflammation index. Same thing again when you got to the clinical pregnancy rates. I'll just pause that for a second. We'll go into here. When you looked at the clinical pregnancy rates, again, that's this top one right here. You had a 48.57% rate in the first quartile versus only 36% in the fourth quartile, and implantation rate, similar findings. All across the board, you have these huge increases in the outcome if you are in the lower quartile compared to the higher quartile. Now, just to go back for 1 second, because I think this is important to share with you guys. If you look at your live birth rate in this study, and I want to highlight this for you right here, in the lowest quartile, it's still only 41%, which is certainly not spectacular, but it's also not anything to scoff at either. I mean, yes, we do a better job than 41%, but 41% is a reasonable live birth rate. When you factor in the large age range they included, 20 to 40, that most of these patients only produced an average of about 6 or 7 eggs. And the fact that they were using a very basic protocol with just gonal F, this makes quite a bit of difference. So those factors are leading to the number that you're finding here. And yes, this number isn't the best live birth rate ever, but this is a reasonable live birth rate and certainly representative of what a lot of centers would actually get using the same protocol with the same patient population. So I think that's important to remember. Is it perfect? No, but is it decent? It is very decent. So what they then did was they took this and they analyzed it by putting in all the confounding variables. Interestingly, they did not include the number of embryos transferred and whether it was cleavage stage or not. However, they did include the fact earlier that there was no difference in those groups, so it shouldn't have had an impact here, hopefully, but I would have liked the data a little bit cleaner in this calculation. So in the first category, let me go back for 1 second, sorry. Let's just back out the little lines that we drew there. So if you go into right here, so this is where this data starts. And if you look there, the first column to the left is the crude model. So that was just no adjustments. Then they had a minimally adjusted model, and then they had the fully adjusted model. We don't care about anything but the fully adjusted model, because quite frankly, that's the only one that's important. Their reference group is that first quartile, the one with the lowest amount of inflammation. So compared to them, if you look down at these numbers here, you can see that the the fourth quartile had a 49% decrease in biochemical pregnancy rate compared to the first quartile. And that's huge. And when they did this as a log transformation, they showed that for every decrease, you're looking at a 48% decline. So that's very significant. When they did this again in terms of clinical pregnancy rate, you can see that in the fourth quartile, and again for that log transformation, same thing, almost a halving of the rate if you're in that fourth quartile versus the first one. When they looked at this in terms of early pregnancy loss, you had a highly significant 100 and almost 30% increase in early pregnancy loss, meaning this can predict miscarriage if you have that high inflammation index. And then, of course, the live birth rate, which is our holy grail, that's a 61% decrease in the fourth quartile versus the first quartile. So these are very significant numbers. This is a super simple test that can give you a prediction in a fresh embryo transfer of what your success rate would be. I would love to see the data for this, looking at this in terms of patients that had a non-live pregnancy, or sorry, a fresh embryo transfer, because that would be huge for us as well. And certainly something easy we could study here, just doing a CBC on patients before they do their embryo transfer or on the day of embryo transfer, and then seeing what the yield for that is in terms of predicting success. Could we maybe on the day of progesterone start test patients and see that their inflammation index is too high and cancel their FET because they're going to be in a much lower success rate? I don't know, but it's certainly food for thought, and it's something we will definitely start looking at. And I think this has a huge amount of promise for something very, very simple and elegant to provide an enormous amount of data for us moving forward. So, welcome back to the show. I hope you enjoyed the fertility factor fiction. Can you predict your IVF success rates? You might be able to with this very simple predictive tool, which is a super easy calculation anybody could do with their own numbers and determine, are they at a higher risk of failure than normal because their body is inflamed. So the reason I love this, this backs up everything we said about the inflammatory response in things like COVID and vaccination, and why people should avoid, transferring at specific times. I had a nurse who was acting as a surrogate for us some time ago. And we never ended up going through with her because she was arguing that it was okay for her to transfer immediately after a COVID infection. When I told her no, it wasn't, she got quite perturbed and was upset and refused to continue. And we essentially said we didn't feel comfortable working with her anymore. And so we released her from being a surrogate with our client. And that unfortunately never worked out. And I think a big part of it was her body would have been inflamed for a variety of reasons in her case. And so we didn't go forward. And I'm glad I didn't, because I think I would have wasted that embryo. They did end up moving those embryos elsewhere, and they tried and they failed. So I think it's a really good warning sign for everybody. If you have an infection, if you have inflammation, it's important to deal with that stuff. People always say, oh, all this reproductive immunology, there's no proof. There's great proof. I mean, something as simple like this is good proof, but even better, there are entire journals dedicated to this topic, like the American Journal of Reproductive Immunology. It's an entire scientific journal dedicated to assessing how reproductive immunology impacts your success. So hopefully this was useful for you guys. If you have questions, I'm open to them, of course. Otherwise, we are going to be taking your questions live. And we have an exciting year planned for you guys. We've got some very interesting people that will be coming on the show soon. I'm going to be back on Dr. Amy's show. I forgot to mention that to you. The Egg Whisperer wants me back. And so, yeah, we got lots of cool stuff coming up. And some people will be bringing on our show as well.
Soraya is asking if you have any tips on how to find a man.
I have no tips on how to find a man, unfortunately. Sorry. Sorry, I had no idea you were single. I'm sorry to hear that, but I don't know. Tarek Adams taken your brother, and I don't have any brothers, so I don't have any help for you there, Soraya. Sorry. Yeah.
Yeah, she's laughing. There you go. You can see it myself. I forgot you like to see these.
Yeah.
Okay. In response to the study we just reviewed, is this inflammation test something you're doing for all patients?
We just read about this. I literally found out about it day before yesterday and thought, oh my God, what a great option for our topic for fertility factor fiction. So yeah, I'm going to start doing this. Now, again, I don't know that this applies to our patient population, because probably 99% of our patients are getting frozen embryo transfers, because I'm a big believer in that. But I mean, this is a super elegant and simple study to do. We'll run a CBC on patients right before maybe we start their progesterone or at the start of their FET and again, and see how inflamed they are. And if there's a lot of inflammation resulting from, whatever, or just naturally present in their bodies, I may tell people in the future to hit the brakes. We could easily duplicate this study and get the data that we need. So I think it's a very exciting opportunity to do very, very simple research. And we could even do this prospectively. So I think it's going to be very, very cool for us.
Hi T, and I suppose Dr. V. That's how we're starting the new year. That's
Wow.
how we're starting
They
the new
just,
year.
yeah, that's how you're taking, that's the direction you're taking the show this year.
I'm gonna be up there, lab coat and all. What's the difference between LH surge and LH peak?
The LH surge is a process where you begin the surge and it starts to rise, it peaks, and then it gradually comes back down. The LH peak is the top of the surge. So there are different representations. The surge is an event that goes on for about 24 hours. The peak is just a time point where it hits its highest level.
In a natural FET cycle, what should progesterone levels be prior to an LH surge? Mine is typically at least 2, and I've seen posts by other REI saying they want it under 1.
Well, it depends on whether you're talking about nanograms per mil or picomoles per liter or nanomoles per liter, I should say. So nanomoles per liter, a one would not be very high at all. That's nothing to worry about. But in nanograms per mil, that's a much higher level. So it depends which unit you're talking about. But if it's nanograms per mil, you do want it quite low. Because if it's not low, you are artificially advancing the endometrium and your timing for your window of implantation will be off.
Um, what months during pregnancy should you not travel?
That's a great question. So the answer to that is there's no prohibition against traveling. The problem is what happens to you if you go into labor either in the plane or have a complication. It doesn't have to be labor, or you are in a foreign country and something happens to you. So, having recently seen a friend go through a pretty tough time with a personal health issue while he was away, and it was a he, in a country with no language that they could communicate with, very distant hospital care, inadequate hospital care. I don't necessarily recommend you go to a foreign location that does not have first world medical services and be pregnant. If something happens to you, you don't know the kind of quality of care you're getting. So the main problem is that most airlines have stipulations saying that if you board a plane pregnant and they need to bring the plane down and land prematurely as a result of something that happens to you in your flight, you're paying for the flight. So check with your airline, check with your insurance, make sure you're allowed to go, make sure you're safe to go. Obviously, check with your doctor, but there's no prohibition about flying. It's the risks you take on.
It's a pretty big,
Yeah, it's like 500,000 if
yeah, yeah.
you're on a big, jet from here to whatever, England or something like that. What do
Yes,
you think?
that's your
There's
responsibility. Yeah.
250 people on a plane like that?
Isn't there always a doctor on the plane? Isn't like that part of
I've
the?
been called for that.
Yeah, yeah, yeah. Is there a doctor?
Yeah,
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 there better be.
yeah,
That's for sure.
yeah.
There
I
better
had
be.
one lady that broke her wrist and another guy that had this whopping headache 5 seconds after they took off.
Oh,
I
really?
said, give him some ibuprofen and a little bit of morphine, let him sleep. They're like, no, we can't give him morphine. I was like, what? So there was another doctor there. She's like, I'll take care of it. I said, great, you take care of it.
There you
So,
go.
yeah,
See, luckily that didn't happen when I was on a plane. I'd be confused whether to go or not go.
yeah, exactly.
Hi.
Hi.
What are some ways to lower FSH?
There are ways to artificially lower FSH. If you take the birth control pill, it'll lower your FSH. But if you want to naturally, so to speak, reduce it without taking hormones, the only thing that actually has ever shown to significantly reduce your FSH is to do ovarian PRP. I'm not aware of anything else that'll do it.
Happy New Year's, Dr. V and Mr. T. Which is better for endosuppression, Oralisa or Lupron Depot? And is letrozole needed for both?
Um, Lupron Depot is definitely stronger than Oralisa. The question you're asking about letrozole is a really good one. I am not aware of any studies that combined Oralisa with letrozole for endometriosis suppression prior to an embryo transfer. However, there are now two studies looking at Lupron and letrozole prior to embryo transfer for endo patients or even non-selected patients. So patients that had unexpected or unexplained failures. So yeah, we would definitely be looking at those patients, and that's the protocol that we use. Yeah, we use Lupron and letrozole. I don't use Orilissa and letrozole, not yet. It's certainly an interesting idea, and I know people have tried it. I just don't know if it works, so I can't speak to that.
Hi, Dr. VNT. Is Ducoral safe for pregnancy?
Ducarol? Yeah, it's fine.
It's fine. Nothing to worry about. Take your
Nothing more.
Ducoral. Is premature rupture of membranes associated with being thin?
Mm, That's a great question. Probably, I'd have to look that up. Um, it is associated with being obese, and extremes of weight can impact things. The number one prediction for premature rupture of membranes is actually infection. That's if you're talking about preterm, like preterm, premature rupture of membranes. So thinness probably is a risk factor. I'd have to look that up. That's a great question.
What does letrozole and Clomid do together? Prescribe 10 milligrams of letrozole and 100 milligrams of Clomid a day.
Yeah, there's a lot of people that have tried that. I think it's too complicated, so I don't do it. There are theoretical advantages to doing it, but I've just never done it before. Supposedly, it improves the response.
Is there any studies on exercise and labor? For example, faster, less C-sections, etc. Let me specify. Exercise during pregnancy, not during labor.
Yeah, exercise during pregnancy reduces your duration of labor. Labor onset's better, higher chances of delivering the baby vaginally. There's a lot of benefits to exercise during pregnancy. We have that on our
So
exercise
there,
and pregnancy
exercise and
video.
pregnancy, yeah, I was about to
Yeah,
say that.
yeah.
So there was a comment to that question,
Okay.
and for your own intents and purposes, since we have some stars on the show.
Oh, okay.
So Carly was asking the question about the
Hi, Kurt.
exercise,
Okay.
and then someone responded to her saying, against Dr. V's advice, I was a couch potato, and my first labor was 4.5 hours long.
Oh, wow. Hey. Well, I can't recommend being a couch potato while you're pregnant. For those of you that think you quote unquote got away with it, the reality is that there are risks from that, right? Blood clots, diabetes, high blood pressure, many different factors. Even if they don't show up now, those are things that can show up later. So try and avoid that if you can.
Hi to the best duo, you and me. If a day six embryo is used,
Thanks for clarifying.
yeah, of course, of course. That's
I thought she
important.
was referring to both my personalities.
You have great personalities. You have great
Uh,
personalities, without a doubt. So it's the best duo. If a day six embryo is used,
yeah,
do you use 6 days of PIO and prometrium before the FET?
yeah, we do. Yeah, years ago, God, that's probably 3 years ago now. We had this great study that looked at whether or not you should transfer day six embryos after 6 days of progesterone instead of 5 days of progesterone. And what they showed was there was no difference in the pregnancy rate, but there was a higher miscarriage rate if you transferred a day six embryo after only 5 days of progesterone. So we, at that point, moved to doing our day six embryos after 6 days of prog. And knockwood, our our miscarriage rates are not non-existent, but they are quite low. So I've been very pleased with that. It does seem to work.
What's your clinic success rate on your first FET with the genetically tested embryo?
It varies, but overall last year we were at 82.3%, assuming that age is not a huge factor. Very, very high.
What causes estrogen producing cysts after priming with birth control? This happened to me twice. I never had a cyst previously.
God, there's so much wrong with that question. Okay, so first of all, no one should be priming with birth control. Priming is a method to either line up your eggs in order to get more of them, or a method to boost the potential or the responsiveness of your ovaries because you want a stronger response. So birth control doesn't help you with either of those. Birth control actually decreases the number of eggs you produce, and so it should never be used for priming. Number two, the birth control pill does not create estrogen producing cysts. You're creating that, and the birth control pill can suppress that from happening, but it actually takes a long time. And the evidence for that is iffy at best. We don't actually know if birth control pill suppresses that. Someone very near and dear to me, we use birth control pill in to avoid getting ovarian cysts, and it did not work. And I can testify to that 5 times over, as she can as well. So we know for sure that the birth control pill does not necessarily prevent women from developing cysts. But no one should be using birth control prior to fertility. It's a method used by fertility centers so that the doctor doesn't have to work on weekends or so that they can batch things. I did that for years because we had to, because my clinic was in Toronto and I was here and it was impossible to manage otherwise. But I stopped the minute I had the opportunity to because we realized that it wasn't good for outcomes. That's the phone call. Yep.
Okay. Oh, what do I want? Jeez
Just
Louise.
answer on that.
Hello?
Go out there. So we have right now a phone call because I'm on gynecology call. So my apologies for that. Can I provide more details about rapamycin for FET for endo patients? Yes. So we did a study on this a while back. We reviewed this on the show, and rapamycin has a very significant increase in the number of live births compared to non-use in endo patients. How much? In the group that had the rapamycin, they had a 95% cumulative live birth rate, which is phenomenal. I mean, who wouldn't be happy with 95%? And in the group that did not get rapamycin, it was only 65%. Two important things to remember there. Number one, the group without rapamycin still did really well. I mean, anybody would be happy with a 65% cumulative live birth rate. The other part of that is that you can get this spectacularly high live birth rate. Do you need me to take it?
Sounds a legitimate question. I couldn't answer it.
Okay, guys, I'm going to be back in 1 second. Let me take that and I'll run. Hang on 1 sec.
It's on mute. Right
Hello.
now. It's on mute.
Oh, maybe ask the next question, Steve.
Yeah, okay, sure. So, why don't I take a crack at some of these questions? Um, maybe that's not the wisest thing to do, but perhaps someone has a question for me, specifically for me, Tarek. Dr. Victory is not here, so we can have a little bit of fun here. Although we have fun every day, I'm sure. But maybe there's a question someone has for me as the understudy here to Dr. Victory during the few seconds that he is currently on call. Or I could just go through some of these questions here and actually try and answer them, see how well you know, how well I perform. Um, oh, what is my vacation spot? It depends, how far I'm willing to travel. Miami is really my ideal spot if I want to get warm, real quick. If I want to drive somewhere, Chicago somehow is way better than Toronto, in my humble opinion. So that's kind of vacation spot questions. So thank you for asking that. Hey T, do you ever use AI to create captions, titles? So helpful. So yeah, Carly, I actually made an entire video not too long ago, and a lot of people find this interesting. And I researched everything, I got all the proofs, and then I actually used AI to find the proofs that I wanted. So I said, okay, I want one, two, three. And then I asked the AI to even like just find these examples of these proofs. And it found the examples. And then we created a whole video. It took like 4 hours to create. And then when we're going to edit the videos to try and find the B-roll for them, my editors told me they couldn't find the B-roll. So then, I obviously, being who I am, I kind of said, well, why can't you find the B-roll? And they're like, well, we can't find it. And I thought it was a lack of a skill on their part to find it, not that the stuff could not exist. That didn't appear to my mind whatsoever. But then when I went to look it up, because everyone's like, Tyre, go find it yourself. I then went to look it up, and sure enough, it was completely made up. So
Yeah, and I've
that
had that too.
yeah, that the AI is really good at giving you information. So coming up with thumbnails and things like that, it's okay for. But if you want real, like if it does not do what you think it's doing. So anytime you do something, just be certain that you fact check it. Even the examples, like I actually had fact checked all the data. So the data was good. I just asked it to get examples based on 3 to 4 years ago. So it should be in its database, and it said it had information from 2, 3 years ago.
No, it just makes stuff
It
up.
just completely makes stuff
Yeah,
up.
yeah, yeah,
It
yeah.
just completely makes
Yeah,
stuff
it
up.
did that to me too. I did that
Yeah,
for one of our videos and
yeah.
I was prepping it and I used AI and then
Makes it up.
it made up a
It
study and then
makes
I
it.
said, give me the reference. And it was like, oh, sorry,
Yeah, yeah, yeah.
we made a
It
mistake.
completely
I'm
makes
like,
it up.
you made up a
Yeah.
study?
So you're lucky that you caught it earlier. I already did the full script.
Oh,
I read the
that's
stats.
painful.
And then between killing myself and wanting to, that time was gone. So,
Yeah.
yeah, be careful out there, everybody. Be careful out there.
There's some interesting questions.
Yeah, that's because I asked them to ask me a question or ask, you know,
That's funny. We've
yeah,
got Soraya's asking where my car is. My car fell off the wall. It died, so
yeah.
it's currently in my hand. Um, Jess is asking if your embryo due date is based on the time of the transfer or not, I think. So, Jess, the answer to that question is that we include the 2.5 weeks of time leading up to your embryo transfer as part of the 40 weeks of your gestation. So, the time from when your period would have been up until the time that you made the embryo, that's included in your gestational age. So on the day of an embryo transfer, you're already technically 2 weeks, 5 days, roughly pregnant.
I got a lot of good questions
Did you,
for what it's
for
worth.
you?
They're like, why don't we ever see your face? And why did I think UT were a doctor? And I'm thinking, you know what?
So full disclosure, the lady you were speaking to on the phone thought you were me.
I'm
And she's like, what do I do? And I'm like, what do you mean, what do you do? She's like, well, what do I do? I just told you. I'm like, no, that was Tarek. That's my social media guy. She's like, oh, I'm sorry. I thought that was you.
Yeah, see that?
Hey,
I am really rubbing off the
we,
right way
we,
here. I have figured it out.
I'm going to get you some sort of Mickey Mouse
I think it needs
medical
to be more than
degree.
Mickey Mouse. I think I can really handle this. I am on my way.
I'm going to print you up a medical degree from somewhere.
I'm telling you, man. The knowledge I have in here.
There is a lot.
There's
We have both learned a lot doing
people
this show.
ask me awkward questions, as I told you earlier today.
Yeah, we
Yeah.
had the well, we won't
Yeah, we
mention
won't
that.
bring that one. Yeah, that's not for the public.
It
But
was a
yeah,
very guy question. I'll just leave it at
yeah,
that.
yeah. But people are asking me. They think I know.
That's cool. Hey,
But the good thing about me is if I don't know,
you just say you don't know.
I just say I don't know. I'm not winging it
Hey,
completely.
I do too. I tell people I don't
Yeah,
know when
I
I
don't
don't
know.
know.
Especially in this realm. Like this is really not. I may wing it on stage here, but there's a limit to the knowledge. Okay, back to the uh back to the important things here.
Okay.
Uh yeah. Okay. So many questions. Great. Tips for severe first trimester constipation.
Oh, pretty much all the stuff you can use is good. So lots of fluids, lots of fiber. So everything bran muffin, bran bread, bran cereal, all that stuff. Avoid things that constipate, bananas, cashews, pears, real apple juice, that kind of thing. And then stool softeners. So Restorelax, Colace is useless. It's been proven useless in 6 different randomized controlled trials, so don't use that. And additionally, consider using a laxative like Dopalax, Senokal, lactulose, glycerin suppositories, whatever you need.
How long should we wait to transfer a cycle after having COVID-19?
I argue 2 months. Maybe with this new inflammation index, you can just do a simple test and figure that out. But I would argue at least 2 months to let your body go back down to what would be considered a more normal inflammatory state. Because we know from the earlier studies on COVID that your body remained inflamed for about 2 months. And that's if you don't have long COVID. Long COVID's a whole other story.
Can you provide more details about the rapamycin for FET for endo patients?
Yeah, I was doing that when we got interrupted. So rapamycin has a huge benefit. I went over this already. So endo patients benefit from it. If you look at the physiological changes that occur with endometriosis, they are very similar to someone who is fighting off a graft like a transplant. And so a lot of those mechanisms are inhibited by the mTOR inhibitors, which is rapamycin. And so you can actually very significantly reduce the inflammation in an endo patient with rapamycin. So their outcome was staggering in that study. I mean, it was phenomenal. The minute I read that, we implemented it into our protocol.
I'm reading the question and actually thinking of the answer. Just so we clear.
Okay.
That was what that delay look reaction was on my face. I'm like, oh, I wonder what you do here. What vitamins should I take or avoid during an FET cycle?
So prenatal vitamin, iron, vitamin D, fish oils, melatonin. Those are the basics. If you have certain conditions, we say that there's more.
There you go.
Soraya says that your friend is funny.
I'll take that. I'll take that.
He is very funny. One thing about Tarek, you all have to know this guy should start his own YouTube channel where all he does is tell people stories because I cannot stop laughing when he's telling me his daily life stories. And a huge, huge thanks and big round of applause. This cannot go unmentioned to his wife, who, for privacy reasons, shall remain nameless, who has her birthday tonight. So happy birthday. And I'm sorry I stole Tarek away from you. I didn't know. I'm innocent. He just told me after he got here. So
It
I'm
was
sorry,
part of the
but
stories. It was part of the comical
yeah,
relief. Yeah, yeah.
yeah. So when I see you with multiple fracture
You'll
casts
know.
next
Battered
month,
husbands,
better
obituary,
husband.
any one of these. there's a chance you
Yeah,
know the reason why
yeah.
now.
You better teach me how to do all this stuff
Yeah, yeah,
before you
yeah.
go, man.
No problem. You just need this
Yeah.
behemoth of a computer here. Happy New Year. How often do you come to your Sarnia clinic?
It varies based on the need. At least once or twice a month, sometimes more. The nurses there are amazing, so they're able to run a lot of the stuff that we do, but I come as pretty much as often as they need me. And we are opening multiple other locations in the next 3 months, so that's exciting as well.
Thoughts on the safety of Zofran during the first trimester?
Um, there are some studies, in fact, I think it's only one, showing a very, very rare impact of Zofran. I am happy using it. I've been using it for probably 15 to 20 years now in my pregnant patients. As you all know, I have a huge pregnant population and I still take care of them myself. I've never once seen somebody have a birth defect because they were taking Zofran. So we use it. I've got no trouble with it. It's not a first line agent. You should use diclectin, but we got loads of women where if you don't give them Zofran, they're going to vomit nonstop.
Hi, Dr. B. Happy New Year. Can you explain the benefits of Lupron Depot and why I still get my period after I used it?
The benefit of Lupron Depot depends on which Lupron Depot you're talking about. If you're talking 1 month Lupron Depot, there's a Cochrane meta-analysis which showed that using Lupron Depot for 1 month as part of your FET protocol increased your chances of success. I think the specific number was about a 46% increase in success rate. So there is a big improvement in success with using that. And that's why we do it with our FET protocols. If you are talking about Lupron Depot prior to FET for 3 months for patients with fibroids or endo, it's useless on its own, and that's been shown in multiple studies. It is only helpful if you do it with letrozole. So I'm not sure which one you're talking about, but depending on which one you're referring to, it can be either useful or useful in conjunction with something else. But you have to know specifically what you're dealing with.
How many weeks after your first monitoring for an FET is the transfer?
On average, about maybe 2 to 2 and a bit, but it varies from patient to patient.
Hi, Dr. V. Welcome back.
Thank you. It's
Can
nice to be back.
assist on a, I'll repeat that again just in case. Can assist on a testicle affect male fertility? Thank you.
Many men will have something called an epididymal cyst, which is a cyst on the epididymis. So Typically speaking, no, but if they're very large, it could be obstructive. So it depends on the size of the cyst. But typically speaking, they're of no clinical relevance if they're small.
Can I whiten my teeth during an FET cycle or the month before
No,
an FET cycle?
month before it'd probably be fine, but not during.
Oh no, eh?
Well, that's a whole lot of chemical. You don't want to be pouring chemicals into your
I
system.
avoid chemicals like the plague. I'm telling you. Anything I see weird, like for instance today, side note, I don't know if it's even relevant, but I saw this individual, they were smoking on a vape. And I said, "Oh, you vape?" She was like, "Yeah, it's better than smoking." And then I said, "Is it?" And she's like, and again, me taking the doctor role full on here, right? I said, "Is it?" And she's like, "Yeah, why not?" I'm like, "Look, I don't believe anyone are quote unquote healthy for you.
Yeah,
My truth here, but I love the idea of having a lighter, lighting something on fire, and then smoke coming out of it. To me, I can understand that process.
okay.
A USB charged device that makes smoke out of thin air, I think that's dangerous. I don't know what's in it, but that's some voodoo in there that'll get you one way or another. So,
4,000 chemicals.
there you go.
So there's actually a study that I just downloaded and we're going to turn into a video about the effects of vaping. So vaping can actually mutate your eggs.
Wow.
Yeah,
Mutate your eggs.
mutate your eggs. The DNA in your eggs can actually get mutated by vaping. It's that bad for you.
That's why I bring these
Yeah,
things up.
yeah,
You know what
yeah.
I mean?
No, it's
I knew you would reference that study. You know
vaping
what
is
I
the
mean?
devil. Like vaping is so bad for you.
There you
Yeah,
go. See,
it's horrible.
I really am a doctor at this point. I'm on fire
This
today.
is rapidly turning into the Tarek show.
Beware. Beware.
Yeah, it might be my obituary soon that you're all reading and not his. I may need to pay his wife to kill him after all.
Does prednisone help with lowering inflammation?
It can. It depends on what kind of inflammation you're talking about. If you've got elevated natural killer cells, if you have high neutrophils, if you have this inflammation index, yes.
What do you recommend doing for a patient who has been TTC for 3.5 years, one loss and no pregnancy since, two failed IUIs, two failed Clomid cycles, stage one endo removed in April?
I suggest you do a consult with us. There are more details that I need to know. I can never answer those questions without knowing all the details. If you ever find a doctor where you walk through the door and they've asked you 2 minutes of questions and then they say, this is what you need, run, because they don't know enough about you to answer the question. So I never answer those questions because I don't know enough about you from what you've told me. I need to know your weight. I need to know your age. I need to know what his health is like. Do you smoke? Do you drink? Do you vape? Are you using marijuana? How many eggs did you have? Where were you working with? At what stage did they trigger you? Like there's so many details, and these are just superficial. I mean, there's a million other things we look at. What are your lab values? What's your uterus like? Have you had previous infections, surgeries? How do you know you have stage one endo? Who treated it? Did they get it all? Like there's so many things we need to look at in order for me to figure out what's best for you. I'm happy to do it, but it's the kind of thing where we got to be one on one. And I typically am spending anywhere from a minimum of half an hour to about an hour and 15 minutes with a patient or a couple on a Zoom meeting or in person to figure all of this out. And then we move forward with a diagnosis and then we move forward with treatment options and I present them to you and you treat, you choose whichever one you want to do.
How do you treat confirmed endometritis?
Well, I'm going to argue about whether or not you have confirmed endometritis. So endometritis, we actually just put up a story. Was it yesterday or today that I attached that to I think it was today. So my friends at Fertility sent back a story where I had they actually screenshotted one of my own, statements from one of our posts, and then they posted it under their label. So the reality is you can't diagnose endometritis because endometritis is wildly and widely disagreed on as far as the diagnostic criteria. And they've done studies where they've given pathologists the same slide. And if you put 10 pathologists in a room, you'll get 11 different answers. They just don't agree on what is endometritis and what isn't. So what we do is we actually look at the bacterial levels that are present in the endometrium, and we use this company called Fertility to do that. And I have no financial arrangement with them. If you want to use a different company that offers it, that's great. I don't care. But that's the only one I know of that does it. And so we use them, and then they tell us specifically what bacteria are there and in what quantity. If the levels are very high, we then turn around and tell you you need this antibiotic for this bacteria, you need that antibiotic for that bacteria, and we can actually target and craft your response and your treatment so that we're getting the right antibiotic in there. Because if you have, for example, urea plasma, and I give you flagyl, I haven't done anything for you. If anything, I've killed some of the good bacteria, and now the urea plasma can grow even more. So it's really important you know which bacteria are there. The only way to do that is to test for the bacteria. Biopsy tests for endometritis are dead. They're as dead as the ERA test. Do not do any kind of endometrial biopsy. It's universally useless.
Is Soraya speaking to you in Farsi or Persian?
Not that I can figure out. Go back. I was seeing that. I don't think so. I think she may have been speaking to somebody else
Oh,
in in
and
um
something?
in where's she from again? I think she's
Morocco.
Dutch. No, no, no.
Oh yeah, she's
She's
Dutch. Dutch.
Dutch.
That's right. She's
She's
Dutch.
from
Yeah, yeah.
Holland. Yeah.
Holland. Yeah, yeah, yeah.
Yeah. I think that was Holland. I don't know. Soraya, was that I don't know. She says Habibi, so if it was anything, it's Arabic because we don't have Habibi. We have Azizan. Yeah.
Aziza.
Hollanda Habibi. See?
Hollanda. Hollanda.
Yeah. T, read my question.
Oh boy.
You've been instructed by Carly.
Orders. There's a lot of people before.
You got
She already got her question in there. For what it's worth.
sorry,
Just
Car.
gotta wait a second. Just hold up. Hold on. Let
Hold
me
on.
see.
Okay.
Um, there's people on top.
Now they're just bossing us.
I know. I feel like I'm being bullied. I'm gonna go home and get beat up, and I'm scarred. There's no place for me to go. I have no space, safe space.
Do you
Uh,
want do you want a hug, buddy?
I feel that. I feel when you transfer a 5-day embryo and it's successful,
Yeah.
does it being a 5-day impact the due date?
That's the one I answered
Oh,
earlier.
okay, great.
Yeah. Jess, that's from Jess.
Do you still recommend NIPT testing when a PGT tested embryo was used and why?
I don't. Some people like to do it just because they want to be super duper sure, but I don't. No.
Thoughts on Vitex to lengthen luteal phase?
Vitex has been shown to be beneficial. I've never seen it specifically for lengthening luteal phase, but it has been shown to have some benefits. So it's not something I use, but it's certainly worthy of consideration.
How common is LUFS? LUFS? LUFS?
LUFS.
Yeah, there's no periods in it, so I don't really know. LUFS, LUFS.
I don't know. Somebody define LUFS for me. I've never heard of LUFS before.
There we go.
Carly says you are being bullied.
I felt it. I felt it.
Yeah,
Oh, your friend is Turkish, the only Abe.
I guess so.
Yeah,
I
Abe.
don't speak any Turkish. Tarek's been to Turkey.
Turkey's great.
I know.
Big fan.
My family loves Turkey too.
Turkey's
But
great. Turkey is
they
great.
forbade me from going because they said if I went to Turkey,
Mm.
this is how crazy Iranian parents are, that somehow magically the Iranians would get a hold of
Oh, to
me
find you there.
and pull me into
And then your
Iran,
head's chopped off.
and then I'm going to jail
Yeah.
forever just
Yeah.
because of my religion.
Yeah.
So yeah,
There you go. We did the NIPT testing. Okay.
yeah,
Great. Okay,
and
well,
it's 8:58.
what's Carly's question?
I
Oh,
don't know.
and you'll star in my birth vlog.
Oh, cool.
I don't know if she's talking to me or she's talking to you,
I
but
don't know.
I'll gladly star in any movie at
If
this
you're
point.
in Carly's birth vlog, we
Yeah,
got some
I'm
issues.
I'm a doctor, damn it.
We got some
I
real.
deserve to be there.
Yeah, I'm gonna hear Code White in the hospital as they're calling security.
She said that wasn't her question. Okay, let me scroll up to make sure. Hold on here.
Why don't we just get her to repeat her
Do
question?
you ever use AI? I answered that question. Sorry, I asked it twice. If so, what type of exercise was in the study and what were the outcomes?
Oh,
Is there any studies
moderate
on
exercise.
is there any studies on exercise during pregnancy and or labor delivery? If so, what type of exercise was in the study and what were the outcomes?
Moderate exercise during pregnancy is beneficial, not during labor. Nobody puts you through exercise during labor, but moderate exercise during pregnancy has been shown to be beneficial. Light exercise is useless, like walking, and heavy exercise can be detrimental if you weren't doing it before. So if you weren't doing heavy exercise before, don't. If you were, it's okay to continue. If you weren't doing any kind of exercise, you should be doing moderate exercise.
It didn't show up. If there was another question, it didn't show up, which would be interesting at the least.
She says maybe it didn't show up.
Yeah,
Yeah.
maybe it
Oh,
didn't show up.
no, still not the question. All right. Sorry, Car. You can ask us now. We'll still answer for you.
Yeah. And 9 o'clock.
All right. One more question
Okay.
because I got to get you home to your wife.
Don't worry. Did you get a chance to research the GDF-15 and do you know any fun facts about how it's causing morning sickness?
I did not. I actually took some time off and did not look at GDF 15, but I will, I promise. Um, so we will look at that for you. We should do a whole show on GDF 15. There's a couple of Carly Steele. Oh, Soraya says to Carly, say it now, darling.
She's got the platform.
You know what? Soraya, Carly says it's okay. Have a good night. Soraya is making me jealous.
This is great.
Oh, this is great. Well, this could be the Soraya and Carly show.
This is a great episode.
All right, guys, we're going to sign off. We will be back. Will we be back next week? Next week, we will be back, and we will see you on Fertility Factor Fiction. I hope you guys have a wonderful evening. Happy New Year. So glad you could spend time with us. I will look up GDF 15. We're also going to talk about something I just found out about from another person on YouTube, which may help the guys out there. Apparently, it's a topical over-the-counter gel that you apply to your business, which helps you with an erection. It's like Viagra topical, but it's not Viagra and you don't need a prescription for it. So I don't have any information on it. I just read about it because I saw it on my YouTube feed for this awesome urologist lady that I follow, Rena Malik. And so I'm going to check that out and we'll probably present on that too. Have a good night, guys. We'll see you next week on